So most of the conditions we can treat with a keyhole operation, so what we call arthroscopic treatment. And that's typically done as a day case. Patients are admitted on the day of surgery, assessed by the surgical team, the anaesthetist, and then typically we do it with a general anaesthetic, but also augmented with a block, which means that the arm and the shoulder is numbed so that there's no pain. And that helps post-operatively as well, because it gives very good pain relief for up to 24 hours. Being keyhole operation, there's smaller scars, which doesn't always mean it's less painful, but it does often mean that the scars usually heal uneventfully and relatively quickly. And typically people can get back to their normal activity more quickly after a keyhole operation. And we can address all sorts of things through a keyhole procedure: rotator cuff tears, impingement syndrome, degenerative changes in the joints, such as the acromioclavicular joint between the collarbone and the shoulder blade, or instability, including using bone blocks to stabilise in the more severe instability cases. So there's quite a lot of options available, keyhole. In some cases, obviously, it needs to be an open operation. The most obvious one is a shoulder replacement. It can't be done keyhole. And that then requires a cut down, usually down the front of the shoulder, and a more prolonged period of immobilisation and rehabilitation afterwards. But that is kind of part of the course of that kind of joint replacement surgery. We talked about impingement syndrome being quite common, and in quite a few cases there isn't a definitive problem that needs to be fixed, in that there might be a generalised tendinopathy, which is all of the tendons aren't particularly healthy, but they're not torn, they're not failed. So although you can't address that problem, you can address the pain that's related to it, and that pain comes from swelling outside the tendon on the surface, and from the bony compression that you get as you move the arm. Because there's a bony roof, then there's what we call a bursa, which is a fluid-filled area between the bone and the tendon underneath. And so if that's all swollen, there's not enough space. And so one of the simple procedures we can do is take away the swollen tissue and take away some bone to give more space. And that addresses the pain, but it doesn't address the underlying tendinopathy. But with rehabilitation and physiotherapy afterwards, there's possibility of improving that tendinopathy in the long term as well. That procedure is termed a subacromial decompression, and it can be done on its own, but it's often part of a bigger procedure in various operations we do around the shoulder, including taking out the end of the collarbone for a acromioclavicular joint arthritis, which is again a joint between the collarbone and the shoulder blade, which is a relatively common cause of pain in the middle-aged active population, particularly people involved in heavy physical labour or heavy physical sports. That's often combined with a subacromial decompression in order to gain access, and also to ensure that any other pain generators are addressed at the same time.